Welcome again to our diagnostic prerequisites, the second part. And for this session, we shall invite from Sampaloc, Manila, Ma'am Trix Guevara. Good afternoon, Ma'am Trix.
Good afternoon, Doc. Good
Oh,
afternoon, everyone.
we hope everyone could join. Okay, this is 100
Mm.
questions, no? Which of the following is a potential cause for the lungs' inability to descend and spread qi?
The upper Chiaotzi chaos from shock exposure.
So that means the lung and the heart are going to have issues now. So
Mm-hmm.
if you will be exposed to shock, if you will be a witness of a murder, you might. Okay. What is the purpose of
Yes,
asking a
shock.
person? Is there anything that provokes the vomiting?
Um, to identify external pathogenic factors affect C.
Yeah. So the most common one would be
Mm.
excess cold. Yeah, cold, no? Too much cold. And you can also
Vomit.
causes. In the context of pulse assessment, which of the following pairings is not mentioned?
Low temperature.
Yeah, warm or cold temperature. Learning diagnostic techniques compares
Mm.
to which of the following activities?
Playing a musical instrument.
Yeah, that means you have to practice every day, at least
Mm-mm.
12 hours a day. No? So if you don't practice, then you don't get to become a good musician. Which of the following is an example? The same way as a practitioner, no? You need to really
Mm-mm.
practice. Which of the following is an example of exogenous cold?
An environment cold invading the body.
What is the most efficient way to remember the relevance of diagnostic signs and symptoms?
By understanding pathomechanisms.
Yeah, so it is still very important to go back to basics. That's why if you notice, we pattern our review towards that direction. No? Without a very solid foundation, you don't become a good diagnostician. What is the significance of recognizing deviations from the norm in clinical practice?
It helps identify underlying pathomechanisms.
Good. The difficulty of mastering pulse diagnosis compares to which of the following?
Like playing a simple guitar chord.
Yes.
That's
Recommended version a practitioner feels they observe nothing during a diagnostic session.
it. They continue practicing and reevaluate.
Yeah, never stop. Which of the following statements reflects the view on memorizing symptom lists?
It should be replaced by understanding the
Yeah, you need to
pathomechanism.
understand the pathophysiology. What is a sign that the
Mhm.
lung is Qi deficient? Or how will you know if the patient has lung Qi deficient?
Um, they'll have a shallow breath, quiet, rhythmic breathing.
Yeah, because it's deficient. No? If it's excess, it's a
Difficult,
different story.
it's difficult to
Yeah.
breathe.
Which of the following is not a factor that can cause the stomach Qi to become rebellious? Hello?
Hello, Doc.
Which of the following
Hello,
is
Doc.
a factor that can cause the stomach Qi to become rebellious?
The liver fire.
Mhm. Okay. Which condition is indicated when a person feels cold despite wearing thick clothing and a duvet, and also does not sweat or have muscle aches? Hello, what's your answer here?
Hello, Doc. Can you hear me?
Yeah, I can hear you now.
Yeah. The she cold invasion.
Hmm. Wait lang, parang I think there's a problem here. Are you not going to say it's mm, yeah, because the yeah, excess cold invasion. Mhm. Because the pores do not open. Hello, can you hear me? Okay, what is the primary function of Wei Qi?
Warm the skin, control the pores.
Yeah. Cold due to its contracting dynamic affects Wei Qi. How?
By closing the skin pores and inhibiting weight C movement.
So if the skin pores are closed, it would be very
Those
difficult for the Wei Qi to move, no? Which of the following best describes the loophole regarding diagnostic classification? Hello, can you hear me? Hello?
Oh,
Yeah, I can't hear you.
there, can you hear me?
Yes, I can hear you now.
Yeah. Ignoring the dynamics of pathological chi.
Okay, just memorizing, no? A pattern recognition
Mm-hmm.
approach compares to which modern technology?
Traditional computer programming.
Yes. An experienced practitioner differs from a novice primarily because I think you have a weak signal, no? Hello? Can you hear me now?
Yeah.
Yeah. Okay, where were we? An experienced practitioner differs from a novice primarily because
Because they have spent more time observing, interviewing, palpating, and smelling patients.
time is very important and practice. No? Which statement about intuition is most accurate?
Intuition arises from subconscious processing of previously consciously learned information.
Okay. The use of Western diagnosis is warned as a starting point for acupuncture treatment because
Mm, the physiological models underlying the two systems differ fundamentally.
which of the following is not a sign of Wei Qi blockage by exogenous pathogenic Qi?
Fever chills, good chills.
Yeah, okay. Absence of sweating, muscle aches, feeling cold despite warm coverings. Okay. The order in which an experienced practitioner reacts to a symptom
Is they immediately know the substitute number two. Yeah.
yes. Intuition must be based on
Practice number two.
number two, solid theoretical understanding coupled with practical experience. Which of the following best captures the view on memorizing symptoms versus understanding underlying dynamics?
Memorization, hands-on, flexible diagnosis number three.
Which of the following is a risk when basing treatment on a Western doctor's diagnosis? This is what usually happens here. So what?
Logical action of the acupuncture points may not align with the Western pathology number two.
Yes, this is very true. A novice practitioner is more likely to
Likely to spend more time cross-checking symptoms with
textbooks. The primary cause of muscle aches in a cold invasion scenario is
C in the exterior where weight C circulates.
yeah. So the muscle ache is due to chi stagnation in the exterior where the Wei Qi circulates. Which of the following best illustrates the computer analogy?
The computer can recognize a pattern without understanding its cause.
An
Number
experienced,
two.
yeah, an experienced practitioner's intuition is
Faster than conscious reasoning because of subconscious processing.
a practitioner should avoid latching onto and sticking with the first idea that comes to mind. This advice is intended to promote what?
Promote flexibility during diagnosis.
Yes. Which of the following statements about Western versus Chinese diagnostic models is true? Hello? What's the answer?
Hello.
Yeah. What's the
Number
answer?
three.
Yeah, numbers.
Number three.
The two models are based on fundamentally different physiological and pathological
Logical
assumptions.
assumption.
A practitioner who relies solely on memorized symptom clusters without understanding underlying mechanisms is comparable to
Computer program that has with pattern recognition rules.
in a scenario where a person cannot keep warm despite adequate clothing, the absence of which condition is inferred.
Number one, yang qi deficiency.
Which factor highlights as a reason why a Western diagnosis might be incorrect?
Number one, subjective data by different.
Physicians, yeah. The experience of observing, interviewing, listening to, palpating, and smelling contributes most directly to
Directly to number two, enhancing pattern recognition, speed and accuracy.
what is identified as a potential consequence of treating a patient based on another acupuncturist diagnosis when the diagnoses differ.
Number two, the
Yes.
treatment may be ineffective or harm.
What distinguishes an excess cold condition from a young deficiency condition in terms of patient response to external warmth?
Mm, Number two, only yang deficiency improves with clothing.
Yeah.
Excess cold does not.
Intuition is nothing more than just guesswork unless it is grounded in.
Grounded in solid theoretical understanding. And number
Okay. What is the effect of point spleen 3 on the physical spleen considered uncertain?
mm, number two, because the same symptom pattern may not be diagnosed as spleen imbalance in
Yeah. What is meant by translate diagnosis to our own diagnostic models? Hello? What is meant by translate diagnosis to our own diagnostic models? Hello? Okay. What is your answer for number 40?
number two, mapping symptoms onto the Chinese medicine pattern differentiation system.
Which of the following statements best reflects the view on using Western diagnosis in Chinese medicine treatment?
Number three, Western diagnosis can guide the direction of inquiry, but must be reinterpreted through Chinese patterns.
Pianping Lunqi is described as
Described as Western medicine style disease diagnosis that does not incorporate pattern differentiation.
how do we differentiate Pian Cheng Lunqi from Pianping Lunqi?
Uh, Number two, Pian Cheng Lun Chi analyzes pattern of imbalance, while Pian Ping Lun Chi identifies the disease entity.
So the Pian Cheng, there's pattern, no? Whereas
Pattern
in
imbalance.
Pianping, just the imbala, the disease entity. Which example illustrates function of intestinal flora that is not analogous to spleen qi?
Number three, synthesis of neurotransmitters influencing mood.
When faced with the Western diagnosis of estrogen excess, why is there a caution against directly treating with kidney yin acupuncture?
Mm, because estrogen's multiple systemic actions cannot be fully represented by a single organ yin concept. Number three.
Which of the following is not a typical Chinese medicine pathological factor to consider when reinterpreting a Western diagnosis?
LDL cholesterol levels.
Western diagnosis can be valuable because it
Because it highlights physiological domains like hormones that may correspond to Chinese.
okay. Which process is recommended for handling a Western diagnosis before applying Chinese treatment?
Number two,
Hmm.
reconstruct symptoms and logical processes, then reconstruct Chinese pattern.
A Chinese medicine practitioner should avoid which of the following when a patient presents with a Western diagnosis of bacterial infection?
Um, Number two, assuming the infection is solely a heat pattern with assessing C and flu.
Which statement best captures the relationship between Western organ-based diagnosis and Chinese pattern differentiation?
They operate on distinct theoretical frameworks and must be bridged through symptom analysis. Number two.
The phrase pattern, a relationship between the various symptoms and signs, implies that Chinese diagnosis primarily relies on.
Number three.
Okay, number three, integrated analysis of multiple manifestations.
Manifest.
Which of the following would be an incorrect application of a Western hormone diagnosis in Chinese practice?
Number two, treating high estrogen solely with kidney yin point.
Yeah.
Kidney three.
Chinese diagnosis and homeopathic diagnosis are examples of.
Examples of number two, complementary diagnostic approaches that also require translation.
Okay. Which of the following best illustrates the warning about direct equivalence between Western and Chinese concepts?
Number two, equating estrogen with kidney yin without considering its broader systemic roles.
A Chinese practitioner should first verify which of the following when presented with a Western diagnosis. Hello, Sister Rosa.
Mhm.
Hello, good afternoon.
Good afternoon.
Hello, Sister Rosa. Good afternoon.
Hello.
It's good to always see you.
Number two.
Okay. A Chinese practitioner should verify which of the following when presented with a Western diagnosis.
Number two, whether the patient actually describes symptoms and signs.
Why might a Western doctor find a Chinese diagnosis does not make sense?
Uh, because Chinese diagnosis and pathological model.
Number two. Which of the following is not listed as a possible Chinese pathological factor that could explain a Western identified symptom?
Viral load.
Yes. A Western diagnosis of intestinal dysbiosis would most appropriately be integrated into Chinese treatment by.
By number two, translating the dysbiosis into a spleen qi deficiency or spleen yang weakening pattern.
The same disorders can have many causes. This principle underlies which Chinese medicine concept? Hello? Can you hear me? Ito na naman tayo. Hello?
Both of you are loud and clear.
Thank you, Dr. Gavino.
Thank you, Doc Gavino.
My signal that is the problem. Because we are experiencing somewhere in Mindanao and Visayas.
Again.
Mm-mm. Tropical depression, signal number one. I don't know how it affects the Anyway. Okay, we're back.
Okay.
Saan na ba tayo? Okay, the
Okay,
same
number
disorders
nine.
can have many causes. This principle underlies which Chinese medicine concept?
Number 2, multiple patterns for a single disease.
Okay. What is the primary reason why a Chinese practitioner should not treat a patient strictly according to a Western diagnosis?
Number 2, physiological foundation. The two systems differ, requiring
Pattern-based translation. Kasi nga parang weird nga tayo, di ba? So we need to educate our colleagues, our
Western.
counterparts, the Western counterparts. Which of the following best describes the suggested workflow when receiving a Western diagnosis of hyperthyroidism? Ba't hindi ito? What's your answer here?
Number 2, identify symptoms like heat or tremor and map them to a Chinese pattern such as liver fire or heart heat.
Yeah. Pattern, a relationship between the various symptoms and signs, is used to argue that
Just to argue that number 3, comprehensive vision is essential for accurate Chinese diagnosis.
which of the following illustrates the point that Chinese medicine often places emphasis on signs and symptoms that are not viewed as being relevant in a Western medicine diagnosis?
Number 2, observing rapid speech and hand gesticulation as indicators of heart heat.
Yeah. So we need to integrate talaga. Treatment will match the diagnosis perfectly only when
the physiological and diagnostic foundations of the treatment and diagnosis are aligned.
which of the following would be an appropriate Chinese medicine response to a Western identified low serotonin condition? O, diba?
Number 1, treat with liver disease stagnation pattern using points to move C.
Deconstructing a Western diagnosis implies which methodological step?
By separating the diagnosis into individual symptoms and underlying pathophysiological processes. Number 2.
Okay. Which of the following best captures the perspective on integrating Western hormonal concepts into Chinese practice?
Number 3. Hormonal imbalances can inform the direction of pattern investigation, but must be interpreted within Chinese theory.
Which of the following patterns would most directly explain a rebellious stomach chi that sends contents upward?
And stomach fire causing the qi to rise. Number 4. Number 4. Rebellious stomach.
Okay. Which of the following statements about learning diagnostic techniques is not true? Not true, ah.
Not true. Number 2. Natural talent guarantees immediate competence without practice.
Which of the following is least likely to be a primary cause of stomach chi rebellion?
Phlegm accumulate in the stomach. Number 3.
Which diagnostic pillar is not explicitly required for Chinese medical diagnosis?
Palpation of the abdomen.
But we will also learn that in learning pulse diagnosis is likened to learning the guitar. Which analogy accurately reflects this viewpoint?
Number 3. Regular practice.
Yes.
transfers
Pathomechanisms primarily refer to
the dynamic processes causing symptom patterns.
which of the following pulse descriptors would most likely indicate chi stagnation pattern in the upper jaw?
Number 3.
Okay.
Type.
Chi stagnation, wiry ka agad. Kai.
Masakit. May pain.
Oo nga, katulad nung ano ko kanina. Okay. Why might a practitioner feel they are not feeling or observing anything during the diagnosis?
The practitioner lacks sufficient practice.
Which of the following is not a possible cause for the lungs' inability to descend and spread qi?
Excessive blood heat in the liver.
Okay. Observing deviations from the norm reduces the need for what?
Memorization of symptom lists.
In tongue diagnostics, which feature is incorrectly paired with its normal description?
These marks are is normal.
Although we see a lot of patients with teeth marks,
Marks. Yes.
pero they don't feel anything. What is implied about the relationship between common presentations and normal standards?
Number 3. Common presentations may mask underlying imbalance.
Which diagnostic question would best help differentiate between stomach chi deficiency and stomach fire in a vomiting patient?
Number 1. Diffuse a sensation of heat in the epigastrium.
Okay. Which pulse quality would most likely be observed in a patient with chi stagnation in the channels?
Wiry.
Exogenous cold, phlegm, chi stagnation, blood stagnation, or food stagnation. What common functional outcome are these factors hypothesized to produce?
Number 2. Obstruction of stomach chi descent.
The diagnostic process is compared to which of the following activities to emphasize incremental skill development?
Learning a foreign language.
Which of the following is not a suggested method for breaking down the pulse examination process?
Blood pressure.
Alin?
Measuring blood pressure.
Blood, of course. We don't measure that. What is the primary diagnostic advantage of recognizing deviations from the norm rather than memorizing symptom lists?
Number 3. It fosters a deeper understanding of underlying mechanisms.
Muscle aches are a sign of stagnation of qi in which part of the body?
The exterior aspect, where Wei Qi circulates.
Which of the following is not a function of Wei Qi?
Distributed in the limbs.
Which of the following is not a recommended method for a novice to improve diagnostic accuracy?
Number 3, relying exclusively on a single mentor's opinion.
So we have to listen to a lot of mentors.
Yes.
Muscle aches is a sign of qi stagnation in the exterior. Which other sign listed would most likely accompany this in the same pattern?
Number 3, absence of sweating.
Yeah, okay. A practitioner's ability to place more emphasis on certain symptoms is an example of which cognitive skill?
Number 2, selective attention.
Diagnosing excess cold condition would most likely involve which of the following therapeutic strategies?
Number 1, warming-inducing acupuncture.
Which of the following best describes the relationship between the intestinal flora and spleen qi?
Number 2, intestinal flora represent only a subset of spleen C functions.
A Western diagnosis of estrogen imbalance cannot be directly equated to which Chinese medicine pattern?
Kidney deficiency.
What is the primary limitation of using acupuncture points solely based on Western organ nomenclature?
Number 3, physiological action of points may not correspond to Western organs pathology.
If a patient exhibits both qi stagnation and phlegm, according to Chinese medicine, which Western physiological processes might this correspond to? Madam. Oh, unstable na naman.
Number 2, impaired gastrointestinal motility. Number 2.
Ganun ba? Oh, yeah.
Number 2.
Stagnation So it something to do with motility. Okay. Dysbiosis. Which of the following best illustrates the concept that the same pattern of symptoms and signs in a patient will not often be diagnosed as a spleen pattern of imbalance in Chinese medicine? What's
Number 2, a patient with fatigue. Number 2,
okay.
a patient with fatigue may be diagnosed.
Liver qi stagnation rather. Actually, it should be spleen qi deficiency, di ba? A practitioner should ask which of the following when evaluating a Western diagnosis from a Chinese perspective.
Number 3, which organs or types of qi perform the functions described by the Western diagnosis?
Which of the following best captures the stance on treating a patient based solely on a Western disease name such as pneumonia?
Number 2, it is insufficient. The practitioner must discern the underlying Chinese patterns first.
Heat in the heart might be indicated by rapid speech. Which other Chinese diagnostic sign could corroborate this pattern?
Number 3, red tongue tip with a thin yellow coating.
When the physiological and diagnostic foundation must match each other, which principle is being emphasized?
Number 2, consistency between diagnostic reasoning and therapeutic modality.
Wow, thank you very much.
Thank you, Doc.